Hi, I'm Dr. Gawel from Indian Trail Animal Hospital. Let's talk about cat dermatology today. So cat dermatology is a specific branch of medicine where it's going to address the specific conditions that may affect your cat's skin. So we know what those guys look like when they come in the door. They're usually pretty uncomfortable, maybe itchy, red skin, hair loss, examples like that. And so what you're usually seeing at home is, like I said, an uncomfortable cat. Maybe they are a little more withdrawn. Their behavior and their social cues are not what you expect from your cat. Are they overly grooming themselves, whether that's biting and chewing on their arms and legs and body? Are they licking themselves to the point of hair loss? We may see scooting. We can see appetite changes with these guys. One of the more common but not readily thought of clinical sign is inappropriate elimination. Sometimes when cats have a health problem, you see them urinate and defecate outside the box. So it's important to kind of keep in the signs, specific signs of hair loss, itchiness, redness on the skin, but some of these other secondary signs to see if we have an uncomfortable cat. So what are those signs and symptoms that we can see with cats and skin problems? So dermatitis is inflammation on the skin. And like we had mentioned a few times now, that can manifest itself as focal areas of hair loss or more widespread hair loss. There's usually a change to the coat, or excuse me, to the skin. There's redness. You may see flakiness in the coat, or you may even see greasiness. So typical examples of dermatitis would be a skin infection, external parasites, your fleas, your ticks, your mites, and even allergies can cause dermatitis. Other types of fungal infection, for example, ringworm, may cause very focal or widespread lesions on your cat's body where the skin is thickened, we have crusts, but it's not always itchy. Cats can have autoimmune diseases, and again, that may manifest in very focal lesions around the ears, the face, the nose, and sometimes even the paws or the paw pads themselves. We have skin cancers, so lumps and bumps, as well as widespread skin changes. So these are the changes that usually happen when maybe they don't respond to our typical lines of therapy like antibiotics or anti-inflammatories. And lastly, let's not forget about gastrointestinal parasites. A cat with an itchy bottom, itchy tail base, that's a cat I want to really explore and figure out do we have a gastrointestinal parasite infection? So why is it important to bring our cats in when we start to see these signs and symptoms? Well, as we kind of alluded to, there is a wide variety of issues that could be going on that have very similar signs and symptoms with your cat's skin. We'll use our diagnostic tools like the physical exam, where we're literally taking that fine-tooth comb and combing through your cat's coat and fur to see if we find any of these lesions. We can use skin cytology samples, where we're taking samples and looking at them under a microscope, looking for bacteria, looking for yeast, any other type of abnormal cells or organisms that may be affecting your cat's skin. We can collect culture and sensitivity samples. We are going to send that sample off to a laboratory for culture, and that'll give us the ability to grow a potentially specific bacteria, as well as give us that line of antibiotic that needs to be used to treat the infection. Depending on the severity of the skin problems, we may even get into things like blood work, as well as skin biopsies to give us that definitive diagnosis. All of these things together help us come up with a treatment plan for early intervention and management. We want to know, is this something that can be treated with flea prevention, for example? Or do we need other diets and other types of daily medications to control itchiness, for example, with skin allergies? So it's very important to bring your cat in if you start to see any of these clinical signs so that we can get them on the appropriate treatment. Most skin conditions, unfortunately, are more of a manageable condition. So we want to make sure we are going down that right path of managing and keeping these guys comfortable, as well as intervening with specific treatment plans to reduce things like yeast infections or bacterial infections. If you have any questions or concerns regarding cat dermatology, please contact your veterinarian at Indian Trail Animal Hospital today.